This program is designed to provide general information with regards to the subject matters covered. This information is given with the understanding that neither the hosts, guests, sponsors, or station are engaged in rendering any specific and personal, medical, financial, legal, counseling, professional service, or any advice. You should seek the services of competent professionals before applying or trying any suggested ideas. The information contained in this podcast is intended for informational purposes only and is not a substitute for individual professional legal advice. The podcast information was carefully compiled from vetted sources and references. However, R.O.S.E Resources outreach to safeguard the elderly cannot guarantee that you will not fall victim to a scam. Let's talk about scams. It's the must-listen show for anyone who wants to protect themselves and their loved ones from scams. Every Tuesday at 8 a.m. Pacific Time on K4HD Radio, Joyce Petrowski, founder of R.O.S E, and her guests will provide valuable insights and practical tips on how to recognize and protect yourself from scams. And now, here is your host, Joyce Petrowski.
Hi, everybody. Welcome back. I trust you enjoyed last week's show with Brian talking about the urgency and why we need the scam prevention through education out there to educate everybody on how to recognize a scam and prevent yourself from falling victim to it. Today, it is we are in the annual open enrollment for Medicare, and so we are going to be talking to Steve Zlotnick he's a Medicare agent, and about some different Medicare scams and how you can protect yourself. But first, don't forget to go to the website, roseadvocacy.org. On the homepage, you'll find our social media links, and scroll down to the bottom. You can sign up for our mailed and or emailed newsletter. You're going to want to hit subscribe so you don't miss an episode. And you can also find all the episodes on YouTube, but also our letstalkaboutscams.com website. So now let's bring Steve in so we can get going. Hi, Steve.
Hi, Joyce. Thanks for having me.
Thanks. How you doing?
Oh, I'm doing great this morning. Like you said, it's open enrollment, so this is my busy time of the year, but things are going well.
Good. Could you just take a minute and let everyone know your background and what it is you do?
Sure. Yeah, I've worked in the financial services industry for about 15 years. For the past over 5 years now, I've had my own insurance agency. It's an independent insurance agency. It's called Pangea Insurance Services, and I'm an independent insurance broker. I specialize in health insurance and Medicare. So I work with a lot of seniors. You don't necessarily have to be 65 plus to be eligible for Medicare, but many of my clients, of course, are. The majority of people on Medicare are 65 plus. So I work with a lot of our seniors and Medicare eligibles.
All right. Well, very good. So annual enrollment started October 15th. Was that right?
Yeah,
so
correct.
About a week ago?
Correct. Yeah. And depending on what plan you have, I mean, if you have an Advantage plan or if you have a supplement plan, they make it as confusing as possible, of course. But open enrollment can be a little bit different. But really, for most people, if you want a January 1st effective date, so if you're making any changes in open enrollment, that will be done from October 15th to December 7th is our window.
And those changes take effect January 1st?
That's correct.
Okay. And is there some other enrollment period that starts in January and runs for a few months?
And that would be specific to if you had a Medicare Advantage plan.
Okay.
So you do have a little bit of a buffer there. So if you're signing up for a Medicare Advantage plan in January, or you have even a little bit after that, it would then take effect the first of the following month. So if you make a change in your Medicare Advantage plan in January, that change would be effective for February 1st, for instance. But that's specific to the Medicare Advantage only for that window.
Okay. All right. And then I also want to clarify that my understanding of when you have to sign up, you have a window when you first sign up for Medicare, and that's the 3 months before the month you turn 65, the month you turn 65, and 3 months after that. That's your 7-month window.
That's 100% correct. The biggest, I guess, question or what people don't always get right, though, is if you are still working and you're over 65, you don't have to sign up for Medicare if you have what's called credible coverage. And that normally means you have a large employer of 25 plus employees.
Okay.
You'll get a letter every year saying that this is credible coverage. My prescription drug coverage is credible coverage. My health insurance is credible coverage. If you get that letter every year, you work with a large employer and you have health insurance, and say this employer covers your health insurance 100%, it might make sense that you just keep that, and you don't necessarily have to sign up for Medicare when you're 65 in that 7-month window that you referred to. You then can have what's called a special election period. So when you decide to retire or you lose coverage, there's some other instances where you can have that. You can sign up for Medicare and be 67 years old, 68 years old. So your age of turning 65 no longer matters because you had credible coverage insurance this whole time, and you will not be penalized. So that's one of the big things I think people just providing information wise that I do out there. Because a lot of people are still working a little bit later,
right.
Past 65. 10 years ago, 20 years ago, that might have not been the case, but I think,
right.
I get a lot of people that are in their 60s that are still working, and we hold off on getting them Medicare, especially if their plan is 100% covering their insurance. So no point in paying that, Part B premium, right. Almost $200 now. Every month.
So, and you can, is it your current employer that's offering that coverage for you? Is it their responsibility to send you that letter?
The insurance carrier.
The insurance carrier.
Yeah. So one of the two. Yeah. Normally the insurance carrier takes, will provide that. That's part of their responsibility.
Okay.
So it'll normally directly come from them, but depending on how the plan is set up, maybe the HR.
It could go to the HR of the company, and then the HR distributes it to all the people that it applies to.
Right.
So that's interesting. I didn't know that part about it.
That's a big one, yeah.
Yeah, and so, and you mentioned you won't get penalized because you have the credible coverage. So, is there a time limit? Let's say I'm 67, and I am still working and I have credible coverage. I have the letter to back it up, and then I decide to retire. Do I have a certain time limit before then I need to sign up for Medicare?
Correct. Yeah. You don't have that 7-month window. I believe it's a 60-day window in that case.
Okay.
Now the other thing is, now when we're applying for Part B and these Medicare programs, processing takes a little bit of time. So if you know my recommendation is, if I know I'm 67, I'm 68, I held off on doing anything with Medicare, and going in there, signing up through Social Security is where you sign up for Medicare Part A and B. Sometimes you're automatically signed up for Part A, but say you're 67, you have not yet signed up for Medicare Part A, Part B, you're retiring in September. We want to be proactive in that sense and be signing up for Part B, a month or two ahead of time, because processing times are based on how busy they get over there. So sometimes it's sometimes it's 3 weeks processing. Other times it's been much longer.
Wow.
So make sure we're doing that early. They used to let you, in the Social Security system, they used to let you pick your effective date. Like, so I could, an individual could go in there and say, I want my Part B to be effective September 1, and they're doing this months in advance. They don't, maybe if you go in person, they would allow that, but when you're at least online, they're no longer like giving you that option. So they're just kind of processing it, as quickly as they can. And then it's becoming effective, the first of the next month. But again, sometimes that can take over a month or 2 months, in certain instances.
Right.
Yeah. I don't know what's going on with the federal shutdown right now too. That could be a big,
exactly.
So if you're looking at Medicare right now, man, get on that as soon as possible. I bet they're
Right.
backed up.
Right. Yeah. And you mentioned, you might be able to pick your starting date if you go to Social Security in person. You better plan a whole day. Because
But
I
that,
know
yeah,
I had to do that. My mom passed away almost 6 years ago, and I had to go down to Social Security because we had an issue and it required a manager that I had to sit and go through everything with. And I made an appointment and I thought, oh, wow, okay, this is great. I can make an appointment. And all that did was get me through the first line. And then you have to go to the second line, and that could be really long. And then you check in at the second line, and I still waited 2.5 hours before I could see somebody. So it was literally like a 4 to 5 hour, time slot. And everybody's busy, like I say, you don't set aside time to talk to the IRS or the Social Security or anything. But all right, so that's interesting. Um, so scams. Have you seen or heard from your clients or maybe read anything about some current Medicare scams that are going on?
Yeah. My dad actually worked in this field as a attorney for quite some time. He's retired now, but he worked on like government scams, which would include the Medicare and Medicaid system. And so this is huge amounts of money, right, that the
Yes,
government pushes
absolutely.
into these programs.
Right.
So there's a lot of incentive, right, for fraud.
Hmm.
Because we're talking millions plus, right?
Right.
More.
Yeah,
So,
billions. Yeah.
there's hundreds of $1 million scams constantly going on where they are, people are billing, falsely
Fraudulent
billing,
charges. Right. Yep.
fraudulent charges, and using people's information, whether they know it or not, to run up these charges.
So
They're always
I have a question there with that. That's one of the things we warn people about in our presentations is you really need to monitor your Medicare statements, because if you find fraudulent charges, then what's the best thing for them to do? Go directly to their Medicare agent about it, or go directly to the Medicare government office?
Yeah, Medicare recommends that you go directly to them. I can assist in a lot of different ways. So obviously my expertise is more along the lines of the whole. I can help you sign up with Medicare. I can
Getting
help you
people on the
get
right
into
plan.
get you
Yeah.
people on the right plan. I analyze different prescription drug plans and things like that. But yeah, I can certainly point you in the right direction. But in terms of managing that, yeah, directly through Medicare, contact them as soon as possible. Contact your
Okay.
carrier as well. Most people, 99.9% of people, are going to have their Medicare connected to either an Advantage plan or supplement plan. So you want to contact, your supplement or Advantage carrier as well.
Okay.
So that they're aware. And these carriers might pick up on it, even before you, and be the ones that are notifying you
Right.
of charges that just don't look right to them.
Yeah. All right. Yeah, I had a lady once tell me, she was monitoring her statements, and there was like $10,000 in catheters, and she's like, I've never used a catheter. So,
It's common.
and it happens, right? And there might be some little charges that get slipped through in the beginning, right? That kind of like credit cards. Sometimes they'll charge a little bit just to make sure the card's active and it's working, and then here comes all the other charges.
They're just so sophisticated these days
They
too.
are.
It's so easy to miss this. I second guess my, some emails as, a business owner, as you
Hmm.
as well, Joyce. We get these constantly through
Yep.
email, through the phone. They're just so sophisticated now. One thing Medicare recommends that you do, if you have someone calling you directly, first of all, Medicare is not going to call you directly.
Hmm.
Like it says, I believe on their website, it says like very, very rarely in certain specific instances is someone from Medicare going to actually call you. So there's a lot of scams out there. Medicare is contacting you and they're trying to, verify your information. So they want
Right.
your Medicare ID number or this and that, and then you're going to know more on that subject. But yeah, in very rare circumstances are they doing this. So what they recommend you do is if someone calls you and they're bringing up a concern, fraudulent charges, or however they're trying to get to you and your information, you say, okay, thank you. I'm going to hang up now. And then you
Yep.
call the Medicare phone number and then say,
Yep.
this is so-and-so. I just received a phone call from someone claiming that they were a Medicare representative. And then that's, the best way. And, that's how we have to do it as well. And then certain scams that like come directly at me that aren't Medicare related
Yeah.
could be something else. Yeah.
Oh yeah, absolutely. In fact, I during the presentation yesterday I did out in the West Valley, and this lady was talking to me about I think it was the IRS, or no, I'm sorry, it was her bank maybe that called her, right? And they weren't trying to sell something. It was they were talking to her about, are you really writing these checks? It could be the same thing, right? If they're pretending to be a Medicare agent, we think there might be fraudulent activity on your account, but I need to verify you, right? And and I said in that instance, by you saying no, I wasn't writing those checks, you're not giving out any information, but your next thing you say is, if you want to be nice and say thank you, I'll go to the bank myself and hang up, or just hang up, right? And then verify by calling Medicare or calling the bank with their, you have their phone number, going down in person and checking things out. They're going to try to give, whoever's on the other end of the line is going to try to give you a phone number. Oh, I have the bank's number. I have Medicare's number. Let me give it to you. It's just going to reroute you right back into that group that they're in, right? And it won't be them that answers. It'll be someone else, right? Answering the phone. So you mentioned how sophisticated they are, AI. And I would imagine now with AI and voice cloning, they can get people's voices and call Medicare and try to trick Medicare, right? Into something, maybe saying I lost my card. I need another one, but I've moved. You need to send it here. I'm kind of thinking off the top of my head, but and that's something very simple. I'm sure scammers have already thought about it, so I'm not trying to give them any ideas, but um but yeah, I mean, it's the AI part of it is just, and they could, they can get voice recordings of people at Medicare too.
Yeah,
It's
scary what you can
crazy.
accomplish. Yeah, and AI is great in a lot of ways, but then
Absolutely.
can be very scary in a lot
Yeah.
of other ways. I think on the big point you hit on too. So yeah, if someone calls you representing a certain agency, company, whatever, bank, and they provide you the phone number, you don't write that phone number down, right?
Right, exactly.
You go online and and look at Medicare's number, 1-800 Medicare, or you can figure out your phone number, or you just go to medicare.gov and you just contact us, or you'll Google it and you call that phone number. You don't call that phone
Exactly.
number, use the information because that's
Exactly.
another way they get you. Maybe they don't get you that phone call, but you write down that phone number, not really kind of thinking it through, because they're catching
Right.
you, while you're making breakfast, or they're catching you at the wrong time. So you're not
Exactly. Or they're, scaring you that something's wrong with your Medicare account and you might lose it.
right. And you're not thinking
Yeah.
100% clearly because they got you with that fear
Yep.
tactic.
Yep, absolutely. So I actually was doing some research this morning, and found this one website that said the top 3 Medicare scams in 2025, and the first one is the fake Medicare representative call. So obviously they pretend to be Medicare agents. They claim there's issues. They're issuing new cards or need to verify your information, and it's always seems urgent. So we're sending you a new Medicare card. We just need your Medicare number and date of birth to confirm, right? So that's phishing, trying to get your information. And there it is right there. So how to avoid it: use a call blocker app or service and report the call to 1-800 Medicare. So let me ask you about the impersonation then. Um, you as a Medicare agent, if someone gave you permission to talk to them about Medicare, you have to wait until October 1st before you can do that. Is that how that works?
So correct. So that would be like obviously I'll have my book of business.
Yeah.
So we'll have current clients.
Right.
that are currently in their Medicare plan.
Right.
So I'm obviously can help them year round. So we're
Right.
specifically for that plan, in say 2000, and if it's September 2025, I can answer questions. I can do everything with the current plan year. But if I am doing anything that's soliciting for the plan year for 2026 plans, that's correct. That can't be done until October 1st, and that's when the plans are released. So information on changes to the plans happens then. And then we still can't accept applications
Until the
after the
15th.
7th. So that's just when conversations and appointments can begin on October 1st. Before that, and that's that window, and then obviously it goes through potentially past January. But yeah, you're correct in that. So there's another telltale sign if someone is reaching out to you in September about plan information at the end of September, even before October 7th, trying to enroll you. One of two things is happening. It could be a scam, or they're certainly not in compliance.
Right. So
for in Medicare, annually, I have to do a fraud. I do fraud training. I do compliance training annually for Medicare. So it's not just once. I have to do it every year before that window of October. So I generally do my training in August, try to get it done in August. Like maybe I'll have leftover the beginning of September, get it done early. But yeah, every year. So agents should know all this stuff. I mean, it's beaten into us year after year, these types of trainings over and over again, and we have to get a 9% pass rate on the fraud and abuse training. So you have to know your stuff.
Okay. And that is one of the things we talk about is, year round. You might be getting phone calls, emails, stuff in the mail, wanting to talk to you about Medicare. And so it's like if they're but especially I would imagine probably July, August, September. July, maybe the calls start ramping up, but for sure, August and September, they start ramping up even more. And if they're saying, "Oh, we've got this great new plan we think you qualify for," they have no idea what the new plans are because, as you said, they don't come out till October 1st. And one of the tips we tell people is, you might hear about new plans from your friends or family members that are going through the same process, right? Or it could be someone cold calls you and you think they're legit and you're listening to it, but we tell them don't ever, ever, ever make a change with someone that's not your agent. You go directly to your agent. If somebody gave you this information and say, listen, I heard about this new plan. Would this work for me? Because your agent knows your whole situation. Like I give an example, and hopefully I'm correct in this, is that like somebody might try to convince you to add a policy or change a policy, saying you're going to save all this money in doctor's visits or, medical costs. But then come to find out you're paying more than what you saved in prescription costs or in other costs. And so always go to your agent because they know your whole health situation. And, yes, that plan might have saved you money in the medical cost, but your agent's going to go, you're going to be paying so much more in prescription costs. It's not worth it. Right. Or it could be that your agent's like, yep, you were on my list to call. This plan is going to be great for you. Let's talk about getting it put in place. But we just highly stress to them, always, always, always go back to your agent. Because I hear a lot from agents that they find out that, some of their clients will have switched without coming and talking to them first. And I'm sure whoever it is that's talking to them is telling them, oh, you don't need to tell your agent. It's fine. They get notified. This happens all the time,
Yeah. I mean, like you said, I think you're bombarded, especially when you're turning 65 with all this information and you're just harassed constantly. But yeah, during that window coming up to open enrollment, a big one is these Medicare Advantage plans. They will push out, and it's a lot of them. Maybe could be smaller ones you haven't heard of, newer to the market potentially. And yeah, they push big time. And if they're not supplying all the information that they should about the plans, and they're, trying to get you signed up, as fast as possible, I mean, you want to have some caution there and make sure this is same thing with your neighbor. What's best for your neighbor might not necessarily be best.
Everybody's situation is different.
Yeah,
Right.
of course.
Yeah.
And there's a lot of choices on the market too. So yeah, one thing like a dental benefit on plan A might be amazing and a little bit higher on one, but that doesn't necessarily mean it's all the other parts of that plan are going to, fit perfectly for you just because you're getting $1,000 more in a dental benefit or something like that.
Right. Yeah. Yeah. So, and I guess there are going to be people out there that don't work with a Medicare agent. So that's another question is if they don't have a Medicare agent and annual enrollment comes up, do they just have to call the 1-800-Medicare and start talking to somebody there to find out if they should make a change? I mean, is that their only other option other than finding a Medicare agent?
Just like in, I guess, the wealth management field, there's self-directed people. And if you feel, confident that you know what you're doing and you're shopping and you have a system in place where, you're confident or you're happy with things are going, there's nothing wrong with that, of course. I think there's no harm in using a broker. There's no cost to you for that. You have another person to run ideas past, if they're operating from a fiduciary standpoint, they're looking out for your best interest. Right. I don't have any incentive to pick one plan over another. I contract with all the major ones, so I don't get extra incentives from United Healthcare that I do from Aetna or something like that. So I'm looking out for your best interest. So I think there's a lot of value with using a broker. Now, if you use like an agent that's specific with Humana or United Healthcare, they're only going to show you Humana or United Healthcare products. Yeah. I'm not saying that wouldn't be the best option for you. Maybe it would be the best option for you, but you don't know that, and that agent's not going to tell you one way or the other because they're pushing, their specific products.
Right, that they work with.
Correct. Yeah. So to sign up, I mean, you can sign up directly through the carrier. So if you are self-directed, you signed up yourself through, a United Healthcare AARP Medicare Advantage plan, and it's open enrollment, and, there's going to be changes every year. So, you can go on United Healthcare's website and you can look at yourself at the different changes and what options that they have. And you can make a change directly through them. If you're not utilizing a broker, they have phone numbers as well. You can do it over the phone with their agents at Aetna or United Healthcare. Typically, Medicare.gov Medicare provides information on the plans. Through the marketplace, you can sign up, which is a separate under 65 stuff. But through Medicare.gov, I believe they're normally information-wise, you need to go to the carrier to directly sign up for the carrier's products. So we're utilizing, Social Security and Medicare.gov mainly to get our Part A and Part B coverage. But they have information on their different plans on their website.
Okay. This sounds like if you're going to do this on your own, you need to invest a lot of time to do a lot of research to figure out what's the best plan for you. So if I were looking at it, which I will be in 5 years, 4.5 years, I'm going to use a broker. I'm going to use a Medicare agent because they already know, right? Like someone like you that works with, I mean, I can get information for someone that works directly with United or with AARP or with Aetna or whoever, but I think I would want to work with someone who is contracted with all the carriers to be able to see which plan would actually work best for me. And there's different, so there's Part A, there's Part B. I've heard about Part D. Is there a Part C, or did they skip C?
That's called I think they refer to that as the Medicare alphabet soup, because they have all these different letters in there, and I shouldn't say no one knows what they mean, but they could be confusing, right? For first, when you're looking into Medicare for the first time. So Part A is your hospital coverage, and there's some other stuff in there, but mainly think of it as your hospital coverage. When you are working throughout your career, or your spouse is working, you'll see in your pay, and you look at your paycheck, and
You
you
have
see,
Medicare taken out.
and they have Medicare taken out.
Mhm.
It's going to Part A to fund Part A. So for
Okay.
most people, if you have 10 years of work experience, or your spouse has 10 years of work experience, you automatically are covered on Part A at no additional cost because you've been paying into that system. Now, Part B, there is a cost for that, and it can be linked to your income, and they use a 2-year look back. So they'll look
Okay.
at your tax returns 2 years prior, essentially. So say your taxes are pretty high, or say you made a lot of money the 2 years and
Mhm.
you're just retired now, you might pay a little bit more. Some people, if you're lower income, you pay a little bit less or even nothing on Part B. But generally, for most people, it's the standard rate is was it 190, something like around that ballpark this year, for Medicare Part B, and that's your outpatient services. When you go to your PCP, you go to your
Your
specialist. That's what
doctors. Okay.
Medicare covers. So you have Part A and Part B. You get those by signing up through Social Security, and that gets you your Part A, Part B. You get your Medicare card with your effective dates when you do
Mhm.
that, and that's what you need in order to sign up for either a supplement plan or an advantage plan. And it makes sense to go one of those two routes, because otherwise you're on the hook for deductibles and co-insurance and things like that. If you sign up for an advantage plan, a lot of those deductibles go away. There's generally zero deductible for anything, maybe very low on specific plans. Supplements, they're going to go away too. There might be some co-insurance with an advantage plan. On the supplement side, you're more or less paying a monthly premium, and your hospital, your outpatient, all that stuff is more or less going to be, there's different plans, but it's going to be covered, and you're just essentially using you're paying your premium monthly. I don't want to get too into the weeds with all this stuff. This is kind of the first part, the first things I start with a new client that's newly eligible to Medicare, is going over these basics and trying to figure out what is going to be the best route for them. That's the first question you need to answer: is Medicare Advantage a better route for me, or is Medicare Supplement a better route for me? It's generally going to be one of those two, and not just your standard Medicare A and B. Now, so that's A and B. Part C is is Medicare Advantage. So it's just another word for the Medicare Advantage. So not everyone has Part C, because you may have Part A and Part B, and a supplement plan. If you're going that route, you don't have an Advantage plan. You can't have both, one or the other. And then Part D is your prescription drug coverage. So A, B, C, D would be the alphabet soup of Medicare.
Wow. I don't know why they just didn't call it, this is your medical coverage, this is your hospital coverage, this is your advantage, and this is prescriptions. But it sounds confusing. And was it last year during open and annual enrollment that there was a ton of changes in Medicare, or was it a couple years ago?
I think the biggest recent change that just is affecting things for all carriers and plans starting in 2026, or I guess it really this past year, actually 2025, would be the Inflation Reduction Act.
Okay.
So that was put in place to protect consumers from larger expenses, in terms specifically on prescription medication coverage.
Okay.
So out-of-pocket maxes could be $7,000 plus, if you're on these very expensive medications. So that's been lowered by a lot. I mean, it's down to like 2,000 or less. So that's going to be like capped at the max you will pay for prescriptions. Insulin cost was lowered, and that has been a hot spot.
Yeah, that's
years.
last couple of years. Yeah.
I mean,
they talked a lot about it.
Right. That the cost, like, of actually making insulin is not expensive, but they're charging so much on insulin. So that's been a hot spot for our government officials attacking. So that was one of the things they've attacked: the prescription medications, the insulin, lowering costs for consumers. So that's a good thing overall for consumers. But if we look at the flip side of thing, if these insurance carriers are margins change, right? They're making less now if
Hmm.
they were making more. So they have to tweak their plans and make changes. So we
Right.
see, potentially, co-insurance maybe going up a little bit on certain things, or, different things in the plan have to change because they have to make their margins work in their company. They don't when you look at, I guess you'll see in the news or United Healthcare, how much money that they've made. But they're just a huge company. Like their margins from individual to individual aren't like huge amounts. They're not making, all this tons of money off you because one person might be in the hospital and, they're throwing out
Yeah.
$15,000
Well, it's
checks.
the economies of scale, right?
Mhm. Correct. Yeah.
Um, the profit that you make off of one consumer is X, but when you multiply that by millions of customers, then I mean, that's your profits are a lot more.
Yeah, exactly. Yep. Yep.
So,
It's a numbers game.
yeah, yeah. I was going to look back to this article that to see what these other scams. So another one is fake Medicare equipment or coverage claims. Well, we talked about this. They submit false claims for medical devices or services you never received.
Yeah.
And it says to make sure you keep a record of your legitimate Medicare appointments and compare them against your statements.
Hmm.
Did I miss number? Oh, here's bogus Medicare refund offers. They promise a Medicare refund or reimbursement. To receive it, they say you must verify your identity by providing your social security number or bank details. That's where they get you.
I haven't even heard of that one, and obviously that refund does not exist. But yeah,
Right.
it
Yeah.
doesn't surprise me in the slightest. Yeah.
Well, right, because then that's a way to say that,
Nice.
they could actually get into, if you allow them into your system
Mhm.
and, you're accessing your bank account. It's kind of the same thing with the tech support scams. They've evolved over the years and they started doing subscription refunds, right? And then you're seeing that, and in fact, I just talked to a lady about this recently. She was actually putting the $500 in, and she said, I only put 2 zeros, but a third zero came up, like $5,000. She goes, I don't know. And he obviously, whoever it was, had control of her system. And then they're like, oh my gosh, I'm going to get fired, blah, blah, blah. And, you need to give the money back. And so that another way that scammers evolve, right?
Yeah.
And they're not making enough money off their original Medicare scams, so they tweak it a little bit and try to catch people off guard.
Yeah, no, it's amazing. I mean, these are huge operations too. I've seen some of them, and years ago. I mean, they have massive call centers
Yep.
of rows and rows of people that
Yeah.
are doing this, and I mean, the money involved is insane.
Oh,
So
it's really
that's why they're so
insane.
sophisticated. They really are. They're very smart at times, and scary.
Yeah, this article that I was reading, it says in 2024, the Medicare Part D, so the prescription program alone, saw an estimated improper payment rate of 3.7%, which totaled 3.58 billion in losses. And that was just with the Part D program.
Yeah. Yeah. I mentioned my dad.
Yeah.
He previously worked in that field for some time. There was a company out of Florida. I mean, they were doing massive amounts of specifically doing the
Fraudulent billings.
Fraudulent billings with like a pharmacy, and they had a network. I mean, this is how sophisticated the stuff is. I mean, they had a fake pharmacy in Florida, and this whole network of like none of this like actually existed, but it like if Medicare, from their side of the house or from other people, it looked like it actually did because they were doing, they had shell companies and they were billing, they were doing all this billing and they were doing things correctly. It was coming from the pharmacy, it was going to this carrier, it was, so they had it like set up.
Pieces were there.
Yeah. I mean, hundreds of millions of dollars. Yeah.
Yeah. Yeah. It's just crazy. So, I mean, if you can consider the money lost in part A, B, and C, we're in the hundreds of billions of dollars, if, not close to $1 trillion.
Sure.
And so do you think they're just going to say, oh, this isn't making enough money, I'm going to go find something else to do? No, they're making all of this money and we only know based on what people report, right? Um, unless they find the group that's doing it, but I'm sure I shouldn't say I'm sure. My guess is that they're not keeping records of exactly who they scammed and how much they got out of them. But I don't know. Maybe they are. Maybe they're detailed like that. But so I think the dollars lost is just so it's so much more than what we actually know.
Oh, it 100% is more because they haven't caught the ones that are still working, right?
Oh, exactly right. Um, so we're gonna wrap up, but I want to put some tips out there that people can use to stay safe. And you had mentioned a website, Medicare.gov, but I had also found there's one called healthcare.gov. Are you familiar with that website?
Yeah, healthcare. There should be, maybe there's Medicare stuff on there. I specifically utilized healthcare.gov for the marketplace plan. So if you're under 65,
Okay.
the AC, they go by a few different names, but it's the ACA, so the Affordable Care Act plans.
Okay.
We'll also call them the marketplace plans, and it's also referenced as Obamacare plans. So those are all
Yeah.
the individual and family plans for our under 65 individuals and families that maybe self-employed, don't have a group plan that they can get into, or are not Medicare eligible yet. So that's maybe there's some Medicare information on there as well, but usually that's going to be directed towards the marketplace stuff, and then Medicare.gov will be the Medicare stuff. There is a newsletter I get. So if you go to Medicare.gov, you can sign up for a newsletter there, and they'll push out a lot of good information. If there's
Okay.
scam going around, and you sign up
Okay.
for their newsletter, they'll show you, they'll send information about a scam that they found that is going around, and
Oh, nice.
steps you can do, and other information about Medicare. So I highly recommend signing up for that
Okay.
newsletter. It just via email. I mean, maybe they can send it to you paper to your house as well, but I get it via email. But you can go to Medicare.gov, sign up for those. There's a different newsletter options. AARP probably has a lot of good information. I get some stuff from there.
Mm-hmm.
Good company. And I'm sure there's others too, with the carriers and whatnot.
Yeah, that deals specifically. I know in our newsletter, we're gonna because it is annual enrollment, we're putting stuff out about Medicare, and which is why I wanted to do this podcast now because it's the early part of annual enrollment. So um, I think some other tips are going to be if you're not using an agent, which in my opinion, I highly suggest you use an agent. If you don't have one, talk to your family and friends and find out who they use, if their trusted person and all of that. But if you still just want to do it on your own, just make sure you research and make sure you understand all four parts and how they operate and understand what each of them offers you so you can make an educated, informed decision as to what's going to work best for you. And then always monitor your statements. I'm guessing Medicare sends out, I don't know if it's monthly, weekly, or biweekly, but they're going to send you statements that are going to list all of your charges.
And sign up for Medicare.gov. Have a account on there. You can
Okay.
access it electronically. You'll get other information from your carrier as well.
Okay.
Sign up for their electronic stuff where you can get in your system and see up to date stuff. Who knows if you're getting everything in the mail, or if maybe you signed up or your broker signed you up for electronic only statements. So make sure you're logging in there. Or, make sure that they're not in your spam. In your
True.
inbox,
Yeah.
if you signed up for them electronically. Yeah.
And then Social Security had changed their processes. They weren't as of the end of September. They were no longer going to be mailing checks. Everybody had to go on SSA.gov and make sure they had an account set up, and you could do the direct deposit, or there was another, and I don't remember exactly what it was. It was some sort of card or something that you could get each month that would have your benefits on it. You'd have to go on there and look at it, but is so setting up an account at Medicare.gov is going to be very helpful, because you could always go on, if you happen to not find your Medicare statements, or you lose them, you could always go on there and look at your statements and look at your charges, and you can see the charges before you actually get your statements, I would imagine. And then I'm sure they have a button you can push to report fraudulent charges as well. But, like you mentioned, the different carriers like Aetna and United Healthcare, whoever your carrier is, get on their website. I'm sure they do newsletters as well, that they'll send out information, and you'll get information on new updates that they have as well.
Yeah. And, I should clarify, I guess, Medicare is never going to send you a check or the whatever that scam was, but there are certain there are certain plans through carriers, advantage plans, where you can get money to use for over-the-counter prescriptions and things like that. But that'll be a card that they send you, so they're not going to contact them and get a check sent or anything like that. But they'll send you either the same card that you use for everything, or a separate card that you can use for certain prescription or over-the-counter medications and other things. So there are plans that do exist. So if you hear something like that, like I get, my neighbor says I get extra benefits, like I get $150 on my card every quarter. That does exist. So I just want to clarify that
for certain things, right? But you're not, like you said, you're not gonna get a check in the mail for a refund.
No, and not from Medicare.
Right, from Medicare, right. Like some people normally got Social Security checks in the mail every month. They're doing away with it. They've done away with it. Everybody by the end of September needed to have signed up for their online account if they haven't already.
So Medicare
anything else?
Them too, yeah.
Yeah. Anything else that you think would be beneficial for the tips?
I think we hit on a lot. No, I think you hit on a lot.
Yeah,
too.
I mean, we hit on the timelines, and about if you're still working, and you have credible coverage, you will get a letter from your carrier or your HR person to prove that, so you won't get penalized. But to start planning early, if you know when you're going to retire, because the processing times could take a while to get signed up. And I mean, most people, I think, know when they're going to retire. Sometimes, a company might force you into early retirement or into retirement, so you might not have too much notice. But
yeah, I mean, I have clients, their company gets bought out by another company.
Exactly.
All the employees.
Happens all the time.
Happens all the time.
Right. Yeah.
So there are those, but most people, like you said, know they're like, okay, I'm going to retire in 6 months. And,
right. Yeah.
That's one of our planning pieces.
Start planning early. So, all right. Well, thanks, Steve. Lots of great information. And I'm going to sign up for Medicare's newsletters, because I don't want to have to go searching the internet on, the new scams that are out there. I'd like to hear it, right from them as to what they're seeing. So I'm definitely going to sign up for that.
Yeah.
So, all right. Thanks again, Steve. Really appreciate your time with
Thanks
this.
for having me, Joyce.
All right. Take care.
Take care. Bye-bye.
All right, everyone. So we a lot of information here about Medicare. Steve's very knowledgeable, and there's a lot. We're in the Phoenix, Arizona area. There is a lot of great Medicare agents out here in Phoenix. I'm sure there's a lot of great Medicare agents wherever you live. If you don't have one, in my opinion, I would suggest you use one. It's not going to cost you anything, at least to have a review done to make sure you have the best policy for you, or policies. Talk to your friends and family and find out if they have a trusted Medicare agent that they use, and talk to that person. And watch your Medicare statements and excuse me. Report any fraudulent charges to whoever your carrier is, and get your Medicare account established online as well. All right. So don't forget, get on our website, roseadvocacy.org. You'll find our social media links, bottom of the homepage. Sign up for our newsletters. You can get one via email and or in the mail. And hit the subscribe button so you don't ever miss an episode. And next week, we are going to be we have a guest. We're going to be talking to her about a scam experience that she had. So you're going to want to tune in for that. Thank you, everyone.
Well, that's all the knowledge for this episode. Tune in every Tuesday at 8 a.m. Pacific Time on K4HD Radio at k4hd.com as Joyce explores a variety of knowledge so you have the power to make scam protection your healthy habit. And until then, feel free to reach out to Joyce and let's talk about scams.